To begin your BE double contrast study, you will want to prepare your room with the following supplies. First, we have our barium bag with the attached tubing at least 2 feet higher than a recumbent patient. We will get to that. You'll have your lube somewhere. And you will have an absorbent pad taped to the table, a sheet for covering, and towels for cleanup, as well as a trash can nearby. Also, make sure your bathroom is stocked with fresh gowns and washcloths. After the room is properly prepared, the tech will call the patient back into the room to explain the procedure and gain a thorough patient history.
I need to know, Alicia?
Yes.
Can I get you to confirm your last name and date of birth?
Spirit 11/12/99.
Right. Alright, so you can come with me into the room. Okay. So first, I need to ask you a few questions. Is there a chance that you're going to be pregnant right now?
No.
Do you have a history of cancer?
No.
Have you had any surgeries in the area?
No.
Do you have any known abnormalities in the area that we're going to be looking at? And do you know what study we're going to be doing today?
3.
Alright, is this your first one?
Yes.
Alright, no problem. That's what you got me. Alright, so first we're going to do is I'm going to have you lay on the table and we're going to take what's called a scout image so that we have an image to compare to after the study. Then you're going to take a picture on your left side, then we're going to fill you with barium, and once you're full, we're going to empty you, and then fill you with air. And we're going to take a picture on your left side, 1 on your right side, 1 on your back, and 3 on your stomach. And then we'll be done. And then you'll be able to go to the bathroom and clean up. Okay.
After the patient history, the tech will take a scout KUB image, to which he will then present the case to the physician for final approval of the study.
I need to feel your hips so I can line up my picture. Is that okay?
All right.
Once the patient is confirmed by physician, the tech may then begin the procedure by instructing the patient into a Sims position.
All right, ma'am. Can I have you lay on your left side? There we go. You're gonna bring your right knee over. Perfect. All right. I'm gonna insert the tube. All right. And then you can go back, lay on your back. There we go. And I'm gonna lay a sheet over you. Okay.
So now the physician will instruct the tech to fill the patient with barium, and once that is filled, the tech will then assist the patient in rolling around a full 360 to move the barium and coat the large intestine.
Alright, so I'm going to have you roll to your left side. You're going to roll all the way around it. Keep rolling.
Once the physician states it is time to drain, the tech will place an unclamped bag on the floor to commence drainage. Once the physician states it is time to drain, the tech will place an unclamped bag on the floor to commence drainage.
I thought you already did that.
Oh, fuck. Drainage. After drainage is complete, place the bag between the patient's legs, and the tech will give about 15 puffs of air and assist the physician with the remaining images. Our first position is the left lateral decubitus. The patient's
Okay, I'm gonna have you turn on to your left side. And scoot back up against the plate.
As you can see, the patient's left side is down on the table with her arms by her head, and the tech will confirm that it's true lateral, centering the central ray to the MSP and the iliac crest.
Okay. I'm going to have you take a deep breath out, or take a deep breath in, breathe it out, and hold the breath out. And we're going to take a picture at 120 and 2.
So our next position is the right lateral decubitus, where the patient's right side is down, essentially the opposite of the left lateral decubitus, centered to the mid-sagittal plane and iliac crest.
Okay. I'm going to have you take a deep breath in and breathe out. Hold the breath out. And we're going to take a picture at 120 and 2.
Our third image is going to be of the AP, where the centering point will be to the mid-sagittal plane and the iliac crest. You had noticed from the last two positions, we are giving two puffs of air before each image is taken.
So same thing, take a deep breath in, let it out, hold the breath out, and take a picture at 120 and 2.
Our fourth position is in our PA. And again, before taking the image, there will be two puffs of air, and this is to prevent backflow of the barium and to keep it in the large intestine as much as possible.
All right, how you doing? You hanging in there?
Good.
All right. So, same thing. You're gonna take a deep breath in and let it out, and hold the breath out. And we'll take a picture at 120 and 2.
Our next image is the sigmoid PA axial, also known as the butterfly. The patient is in a prone position with a 30 to 40 degree caudal angle, which will exit at the asus in the mid-sagittal plane.
Again, take a deep breath, let it out, and hold the breath out. Take a picture at 120 and 2.
So after the sigmoid position, The tech will then double check all the images to confirm that he has the required anatomy. And then he will set up for the cross table rectum projection, and this is before the removal of the tip. In this one, he's using a 10 by 12, and he's centering to the ACIS in the mid-coronal plane, midway between the front and the back.
Okay, so now got everything all set, got the exposure factor set, and we're going
Now
to
he will deflate the cuff, remove the tip, place it in the trash can, and then finally he's going to take a quick image as fast as he can.
Alright, take a deep breath in, let it out, hold it out, take a picture at 120 and 6.
That was easy.
And finally, the tech will escort the patient to the bathroom to take care of business as quickly as possible and as safely as possible.
Alright, you did great, you did, and we're all done. And have this, hold this against your bum, and you're gonna go in the bathroom. Alright, go back.
And they're meant to clean up afterwards.